My fear, my concern is that your executive order is placing our children in harm's way. It is not true that the Delta variant does not impact children. Science and objective health data shows us differently.
School boards, administrations resist. And Governor Lee and our leaders, do your part.
No one cares more.
Well, Governor Lee has said it should be up to a parent to decide if their child wears a mask, not the school board. His executive order does not apply to private schools, some of which are enforcing their own mask mandates.
Cardona sent Governor Lee and Tennessee Education Secretary Penny Schwinn a letter saying, in essence, the governor's order goes against the department's goals of keeping our children safe while restricting local school boards. This comes after President Biden asked Cardona to take legal action against governors who are standing in the way of local school board mask mandates. Now, this letter that the governor received says that the state's actions to block school districts from voluntarily adopting science-based strategies for preventing the spread of COVID-19 that are aligned with guidance from the CDC put these goals at risk and may infringe upon a school district's authority to adopt policies to protect students and educators as they develop their safe return to in-person instruction.
Today, I asked Maury County Mayor Andy Ogles if he agrees with mask mandates in the classroom, and he told me he does not. He does not agree with the way that Metro Schools is sticking with mask mandates for students and staff. Today, I asked him, though, if the latest numbers have him rethinking.
The Department of Health's statewide graph of COVID-19 hospitalized pediatric patients points to consistently upward trends. It's a topic I questioned Maury County Mayor Andy Ogles about Monday.
You know, I've interviewed some Vanderbilt health experts who say, hey, our pediatric ICUs, we're seeing more and more patients in there. They say wearing a face mask could prevent having more patients and more students getting COVID. What do you say to that, especially since you are a father?
You know, I have access to the dashboards. This notion that there's this wave of children being overwhelmed by this is more hyperbole than fact.
Tonight, some health experts warn the number of current COVID-infected children could worsen with time due to students returning to the classroom and a lack of face coverings, says Assistant Professor of Pediatrics James Anton.
We also have a big concern about this winter and what's going to happen with COVID-19, influenza, and potentially a continued RSV season. And I don't think anybody knows quite yet what this winter is going to look like.
Today, Fox 17 News contacted Maury County's health department requesting pediatric hospitalization rates for children up to 17 years of age. I'm waiting on their statistics to confirm Mayor Ogles' perspective.
I refuse to close. I refuse to do mandates. I've protected people's rights to be open. We had our county fair, and yet where do we rank? When it comes to COVID total cases, we rank right in line, actually lower than our population here in the state of Tennessee.
A difference of opinion from the growing number of health experts urging the public to mask up.
The interview that I did with Mayor Ogles was Monday earlier this week, but I did reach out to him today asking if he wanted to do a follow-up interview in response to the latest COVID-19 numbers for school-aged children. I did not receive a response to my request for an interview.
Most nursing home residents are vaccinated in Tennessee right now, about 76%, but half of those taking care of them are not, with just 50% of Tennessee's nursing home staffers vaccinated right now. Doctors say the fewer staff members who are vaccinated, the more likely the elderly are put at risk.
Nursing home residents getting rushed to hospitals. This was reality for many families last spring as Tennessee's elderly felt the worst effects of COVID-19.
It's been a nightmare, and it's utterly frustrating.
Jamie Vinson's mother was among the thousands of nursing home residents hospitalized with COVID last year. She spent 2 months in the hospital before making a full recovery.
I was never happy about her having to be in a nursing facility from the get-go, but then, COVID happened and it was worse than I could ever imagine.
Dr. William Schaffner says staff exposures are the main way nursing home residents catch COVID-19, and the best way to prevent new exposures is through vaccinations. Critics say everyone should have a choice on whether they get the vaccine, but Dr. Schaffner says people have a responsibility to get it, especially if they work with vulnerable patients.
The nursing home workers should do everything they can to prevent the fact that they might bring the virus into the nursing home.
But data from the Centers for Medicare and Medicaid Services shows only half of Tennessee's nursing home staff are vaccinated, the 6th lowest rate in the country. And some mid-state facilities report 30% or less of staff members vaccinated, and a handful report 0 to 3%.
Is that accurate?
I reached out to facilities with the lowest rates in the mid-state. Administrators tell me it's a reporting error. Their rates are closer to 50 and 60%, and they're doing their best to get to 100%. Family members like Jamie hope staff will do everything they can to protect the vulnerable people they work with every day.